We have with us Mr. Randeep D, who's the State Mission Director of ABDM in the Karnataka state. Thank you for joining us, sir. Uh, what I want to begin by asking, you were giving a keynote just a few minutes ago, and you were talking about the challenges that the healthcare sector is facing at this moment. You spoke about some of the zoonotic diseases or challenge that we have. You also spoke about the communicable diseases or infectious diseases, if I may, like dengue or malaria, which are still prevalent in the country and at large. What are your current views around these challenges?
I think holistic approach is required. My only aim of kind of focusing on these issues is that while we may say technologies are in place, we may say that newer treatment procedures are in place, but the preventive aspects of healthcare really need to be improved. And I think that is where the challenge lies. That how do we protect ourselves in terms of better health, overall health and wellness of the individual. Wherever preventable vaccines are available, how do we stay vaccinated and stay safe? How do we keep our environment clean, ensuring that vector-borne diseases do not spread? Overall, my focus is that, because once you get into the treatment and curative aspects, as you are well aware, it's a never-ending cycle. I mean, it has very deleterious effect on health, and thereafter the cost financials, with medical care being so very expensive to a large population of our country. So I think more focus on the preventive and the wellness aspects will definitely ensure that we are on the path of prosperity.
You also spoke about that as we move forward, there'll be more diseases like zoonotic diseases. What makes you, say that?
Simply because we are seeing a resurgence post-COVID of a lot more communicable diseases, even influenza, the different variants. We're seeing a rise in the vector-borne diseases, Zika, dengue, chikungunya. Diseases which we felt, communicable diseases which we felt were not going to hit areas which are relatively clean, which are relatively urbanized. We are seeing a resurgence of such diseases. So one really needs to think, I mean, why these are getting resurgent. Is it because of lower immunity post-COVID? Is it because of climatic changes? Is it because the virus itself has mutated and now we are facing stronger viral infections than probably earlier? Is it because of antimicrobial resistance, which has come in most of our medication that we've been taking again and again? So these are larger subjects of study, and I just wanted the group here to ponder upon those aspects rather than only focus on technology, screening and other kinds of devices. While that is very important, but also to reflect on this is equally important.
Right. The Nipah virus also mutating, and the fatality being somewhere into 40 to 70%,
Yes.
as they're saying. Right. Now, you also spoke about the digital data protection bill, digital personal data protection bill, which was passed in the monsoon session of the parliament. Now, what are your what what opportunities, what benefits does that give to the healthcare sector in a whole, and what are some of these issues, challenges? You know, critics are they saying that compliance from the private healthcare entities might be an issue. Uh, it says that you have to create robust cybersecurity mechanisms. You have to appoint data officers and do assessments on regular intervals. So that compliance is the issue that the critics are talking about. First of all, let's talk about the kind of benefits that it gives.
No, ABDM is a truly revolutionary kind of an initiative, because it tries to bring three stakeholders on the same platform. One is the healthcare facilities, which are the hospitals and the clinics. Second are the healthcare providers, which would be the doctors, the nurses, the entire medical fraternity, the paramedics. And the third and the most crucial is the patient himself or herself. So these three are all given IDs on a digital platform. You have the health facility identification number, then you have a health professional registry ID for the doctors and nurses, and the patients have something known as a ABA, which is the Ayushman Bharat Health Account ID. Having a digital presence of all these three stakeholders would mean that a lot of data exchange and flow can now happen, which means starting from a registration of my personal details at a healthcare facility, to my diagnosis, to the prescription, to the drugs that I take. And it gives me an opportunity now to have this data on my laptop, on my mobile, wherein I go from one healthcare provider to another. And with my consent, the doctor at facility B can pull out data what was available at facility A. So you have rightly hit the point that private healthcare practitioners and hospitals would have to agree to this in the longer run, because it is at the end of the day going to make it easier for the patient. Now, if everybody is protective about their own systems and say that migration of data is not allowed, we are really looking at having our customers not going into some other hospital, it's not going to work that way. At the end of the day, it is about the patient, it is about his or her comfort. And since there is a data privacy consent built into this overall system, it is completely in the control of the patient as to what data can be shared to what extent, with which doctor, with which facility. And the responsibility of the hospitals also is equally important, because in ABDM, most of our government hospitals have a head start. We have digitized the platforms of government hospitals now. Most of the patients who come to our hospitals are given an ABA ID. And some of the people who know how to access mobiles are able to see their reports now online. Their diagnostic reports, even their x-rays are visible today. Their hematological tests are available today on their mobile. They're able to access the prescription, the drugs being issued. So there's a lot more transparency today. A digital trail of the medical history of the patient is kept. So tremendous advantages and benefits, and I would urge through this platform the private establishments to hop on board, because it's not really something which is mandatory and we are pushing. It doesn't work that way. So it's while it is voluntary, we would urge many of these establishments to come on board as soon as possible, purely in the interest of the patient and for healthcare as a whole.
Thank you so much for joining us here.
Thank you.